All right, we are back with another one, and it looks like I'm seeing right now if I'm trying to recover using backup keys. I see our LinkedIn's have failed, but we're on YouTube, so we'll be able to republish this. Welcome back to another exciting episode of the Survey Readiness Podcast. I'm your host, Dr. Kirk, and joining me as always is my fabulous co-host, the co-host of co-hosts, right? Veronica Caesar, a VP of Clinical Reimbursement.
Thank you so much, Dr. Kirk. Each episode, we break down the regulations facilities are being cited under, the FTACs behind them, and the plans of correction organizations submit to get back into compliance.
You know, this podcast is dedicated to you. It's dedicated to post-acute leaders. It is dedicated to helping the post-acute environment understand survey readiness the way it actually works, not the way we think it should work, but the way it actually works. Go ahead, hit him with it. You know how I go.
That's so true. And so each episode we focus on a specific citation. I'll walk through the FTAC that we're reviewing today, which will be F726, and then we'll explain the regulation behind it, and then we'll break down a real plan of correction so leaders like you can understand what surveyors expect to see.
And you know, every 2 weeks, right, as you mentioned, right, we review those 2567s, looking at leadership failures, compliance failures, and also some successes, right? We want to dispel survey myths that continue to get surveys cited. So, you know, this podcast is educational. At times it is opinionated. At times we will agree. At times we will disagree. But that's what makes this podcast fun, right? It is designed for you. It is designed for us just to, you know, let our hair down. Once again, these are our thoughts at this time, at this moment, in time with the rules and the regs that we have at this time. And I'll tell you why, Veronica, I said that a little later, but yeah, that's at this time.
Right. And so if you're an administrator, a compliance officer, a director of nursing, owner, or regional leader trying to prepare earlier and respond to citations the right way, then you're in the right place.
You know, Veronica, you mentioned it earlier, but talk to us about the FTAG and the POC that we're going to review today.
So the FTAG that we're going to review is FTAG 726, which is compliance programs, right? And so this is very important because, you know, a lot of times we do those in-services and it's not about the in-servicing that you did, but it's actually about whether or not your staff can do the job safely, right? So competency, when we say that, it's knowledge and skill plus clinical judgment and application in real time.
Let's dive into it. First off, hello, you just got off a plane, right?
Yes.
You just got off. Where were you coming from?
I spent 2 days in Nashville with my twin sister. Shout out to Erica. Hey, just working on things. You know, I got some conference coming up this week. I'll be in Oregon speaking at the Oregon Healthcare Association on Wednesday. And so
another keynote?
No, just 3 breakouts. We'll be talking about
just 3 breakouts. Girl, calm down.
Pain and dementia, documentation, defensible documentation, as well as behavior support plans. So very on time, relevant topics. And I always have things that you can take back to the facility the next day and put into action. So I'm very action oriented. So I have a lot of great handouts and things that people can take back to their facility. So I'll be looking forward to sharing some more information about that on our next podcast.
Hey, that's what's up. That's what's up. Let's hit them with the quick sponsors real quick. So we would be remiss if we're not shouting out our sponsor, SurveyGuard. It is the post-acute compliance platform of choice. I'll share an update on that in a minute. You see the chart here. Also, SMK Medical, my consulting firm that focuses on risk compliance, survey prep, and of course, Jim Healthcare Consulting, which is Veronica's consulting firm. So you coming back, and I'm getting ready to leave because I'm actually headed out to do a mock survey in about 2 weeks at the end of April. But I wanted to share something that had just happened to us that's super exciting. I'm wearing a SurveyGuard shirt for a reason today, because we have officially graced the website of Point Click Care as a risk management compliance platform. You go to Point Click Care Marketplace, you type risk management, or you click the risk management box, and there is SurveyGuard. We are also on there for QAPI. huge. We are on there for Quappy. So you just type Quappy and Survey Guard comes up, right? We're the platform. You type risk management, we come up. You've watched me work.
Yes, I'm so excited about Survey Guard. It's a great tool, and it's just going to really change the game. And so I'm just excited about it.
You've been watching me grind behind the scenes. In fact, you've helped me at a conference. You helping me here coming up in Ohio, where you're speaking at in Ohio too, right?
Yes.
Man, how you keep track of everything? You know, because you're educating people so much on survey readiness. How are you keeping track of where you at, where you're going, and how you getting there?
A lot of planners, and of course, my phone. I have like three planners.
I get it. I understand. So,
Mhm.
you're speaking there. You're educating them on compliance risk management. But today we're talking about. Oh, let me get back on the screen. Let me get back on the screen with you. Today I got to fix that. Today we are talking about this new QSO memo that came out. So I'm going to work on getting this on the screen. But talk to us about this new QSO memo that
Okay.
just came out.
So this QSO memo came out about 10 days ago, I believe on April 8th. And so it is CMS has recently clarified the nurse aid training and competency requirements, right? So it's hopefully trying to make it easier to grow the CNA workforce, but also protect resident safety. And so we'll talk about that in our plan of correction review, where some of that didn't actually happen. And so the biggest takeaway for this QSO is that facilities and states now have more flexibility in how training and testing are delivered. So including the use of some remote technology and varied training settings, but the competency standards themselves have not changed. And so CNA training still must include at least 75 hours with supervised hands-on
Yeah.
practice. And then the aides must also demonstrate real skill proficiency before providing care. So it's important to note that nurse aides cannot be charged for training if they're
Mhm.
employed or offered a position, and may even be reimbursed for some costs. So the message that CMS is trying to put out is very clear, that we can be more flexible in how we train, but not in how well staff must perform.
So, have you ever had a training program in your organization?
We did have one at one
Okay.
point in time at one of our facilities. Yes.
And what was that like, right? I have never had one in my facility, but I can imagine it's of a great benefit. But I imagine, I imagine it's a lot of work to go with it.
Yes. So of course, each state has different regulations, whether regarding your star rating, your if you have any immediate jeopardies. A lot of states bar you from having a nurse aid training program, and so there are
Yeah.
certain requirements that must be met to have a nurse aid training program. Also, of course, you have to have an RN
Hmm.
oversee. You can't have an LPN or LVN teaching the class, but there also needs to be an RN overseeing the program. So a lot of times that may be the DON. We did have our DON oversee the program, but then we had an LPN who did most of the instruction. I will say, it's a great resource, especially for some of those rural homes that may not have a lot of nurse aid training programs.
Yep.
um,
Yep.
the reimbursement rights, as you see on the screen where they're talking about nurse aid reimbursement rights before employment, we cannot charge the nurse aid trainees. And then
Yep.
what also may happen is they may go through the program, go through the training. During COVID,
And,
there
and
was a waiver where they could work a certain 120 days without being, tested. And so what could happen though, they could test and then go off to somewhere else. And so it's important that if you do have a
happens
nurse
all the
aid training,
time.
yes. So if you have that nurse aid training program, are you building that culture around them? Are you supporting them? So it's definitely an investment, right? And so you have to treat it like an investment. And so it's important to pour into the trainees, to make sure you select the best trainees who you think are going to to
Yep.
stay, to enrich the residents' lives, and then also be great team members. You don't want to just take anybody, because then they'll take that training and then they'll go down the street and say, I want $5 more on the hour. So it's a lot to
Listen,
consider. Yes.
but it's all about culture because what you just said is right. They came to your school, they took the training, and then they left. So, what was that culture like?
Yes.
Because they signed up knowing what it was, knowing that they had to work for you. right?
Right.
So if they leave midway and or finish and then say, I'm gonna go somewhere else, it's oftentimes, as I'll say, not about the money because they knew what the money was when they accepted the position.
Hmm.
My,
Yes.
my thoughts when we say, oh, they're just leaving for the money, they knew what it was and they
Yes.
still accepted the position. Now,
Yes.
granted, this doesn't ring true all the time, but I think what you're saying is right. They will leave if they feel that they are not valued. They will leave if they feel like no one cares about them. And unfortunately, you can't charge them.
Right.
And in Michigan, I don't know if this is a state as a federal thing, but in Michigan, if you were a new nurse aide and you did your training anywhere else, once you got your license, we had to reverse you that 176.50 or whatever that number is. Is that like that in your state?
When I became a CNA in Ohio, it wasn't like that. I paid out of pocket for that with my income tax.
Listen, so no, and so I became a CNA when I was 18, and so my first facility was a group home. Technically, it was a 40-bed facility. It was considered a group home, so I did not get reimbursed. I never got that opportunity. But as an administrator, I remember signing many of checks to refund people that money. So I think it's good. I think that we need to get more people in the field. Um, as a CNA, just like yourself, right? And we had the same track, literally up to this point.
Yes.
Where we split is when I got the doctorate. You was like, I'm not, but we have the same exact initials after our name.
Right.
So for me, becoming a CNA was a way to get into the healthcare field, and I wish that we promoted that. When I think about
Mhm.
career day, I never saw a CNA come to career day in school.
Yes.
How are we promoting it? So I think the government is doing, trying to make some take down some barriers, but how are we getting those 18-year-olds, those 16-year-olds invested in post-acute care? What's your thoughts?
That's so true. We definitely have to reach them young, right? Because by the time, they're graduating from high school, it's already, oh, I don't want to go work in a nursing
Mm-hmm.
home. I don't want to white butt, and so we need to make sure they understand the enrichment that we provide to people's lives, that the importance of the job. And so if
Yep.
we're able to build our own nurse aid training program and make it a great training program, right? Word of mouth. And so if I'm doing something that I enjoy, something that I feel like I'm making a difference, I'm going to share that, right? And
Yep.
so just
Facts.
making sure we communicate the impact that the nurse aides are having in the lives of residents, in being a team member. And so a lot of times, you could go work at McDonald's or go work somewhere and it's a job, but
Yep.
I really want to reframe the work that we do in long-term care by its impact, by what we do, about the lives that we enrich. And so just the work that we both do, speaking about it, speaking to people, still champion the long-term care industry, is just going to be about just making it be known. I think
A
that's going to
hundred
go a long
percent. 100%. I would have never thought I would be in healthcare. I never thought I'd be in healthcare this long that I am in
way.
healthcare. Never thought I would have got a doctorate. And here we are, right? I'm hosting this podcast with another great person in the post-acute care space, all the way from Hawaii. You're in Texas. Um, Healthcare for me has been an amazing ride.
Mhm.
And I wish more people knew that. I wish more people didn't treat it as a fallback. And when I say fallback, anytime it starts to get a recession, they leave the plane and come right on over.
Yes, yes,
They go from slamming on doors on an F-150 to rolling grams down the road, right? These are
yes.
these are just jokes, but no, seriously. Um, I think that we have to find a way to get people to come in. And so if we can break down barriers for people becoming a certified nursing assistant, let's also start breaking down some of these barriers for people to become a registered nurse or a licensed practical nurse, because we know that there are some barriers in our field that are
Yes.
preventing us from getting the staff that we need. And when we don't have the staff that we need, we're not going to be survey ready. So that's some of the things that I would love to see addressed. I talked about culture a little bit earlier. How do we attract top talent? What are you doing? Because you're a VP. How are you attracting top talent?
You know what? When I was in Ohio working as a staff development coordinator, I was the one doing interviews. I ran the
Yep.
orientation. I was responsible for the competency that we're going to be talking about a little later. So I did all, that staffing, staff competency type of thing. And I worked with an administrator, and he always told me, hire hard, manage easy. And so I know that we are in a crunch for people, right? We're like, oh my gosh, we need people.
Mm-hmm.
But are we really reviewing those applications? Are we taking the time to do the reference checks. Are we looking at, has this person had 10 jobs in the last 2 years, right?
Yeah.
So I understand that we need people, but again, when you talk about culture, right, you want to attract and retain the best. And
Yep.
when you tolerate people who are less than that, you will run away your good people, right? Because good people can go other places. So I
Hmm.
find that sometimes we hold on to people who may not need to be held on to, right? And so
Ooh,
that,
leadership.
yes, so that can definitely, that bad apple can definitely poison the culture that you've built, right? And so I'm always, asking those questions, asking, it's not, we're not just going to take an application and hire somebody,
Yep.
right? We're going to do interviews. So if it's a nurse aide position, a nurse position, did the DON interview? Did
Yep.
the administrator, was the administrator involved, right? And so
Love it.
it's not just the HR manager reviewing applications, calling people in for orientation, right? And then by the time we get them hired, the DON doesn't even know who this person is, their background, or anything, right? And so
Hmm.
I also wanted to say, when we talked about that nurse aid training program, and this ties into our POC and the FTAG we're reviewing, it's not one and done, right? It's definitely not one and done,
Facts.
especially those new nurse aides. They need to be um, mentored, right? They
Hmm.
need to be very closely watched, very
Yep.
closely supported, right? Because when I was a CNA, like you said, you were young, right out of high school. I think
18.
I did 2 years of college, and I was like, I need to make some money,
I
right? So
couldn't
I
get
was
into
20.
college.
I was 20, and but I was scared. Like you said, I
Yeah.
didn't plan on going into healthcare. I remember the first time that I showed up to like actually work on the floor. I mean, my heart was racing, and so just making sure that we support our new
Hmm.
nurse aides, and then understanding that it's not, you do your 75 hours and we'll see you next year. We'll have you sign your in services, falls, abuse, neglect,
100%.
sign this paper, and then not understanding the rationale, the reasoning behind it. So it's important that we understand it's a continuous process,
Yep.
along with our competency training that we're going to talk about too when we talk about our plan of correction and our FTAC this week.
So I like I said, I couldn't get into college. Like community college passed me up. So it was like, go ahead and try trade school, my man. Come on back when you can figure out your life. So best decision I ever did was to go be a CNA, because I think that has shaped me into the person that I am today, which is service led individual.
Yeah.
When we talk about our F tag or plan of correction, which I think they're the same this week, right? We're talking
Mhm.
about F726 and the plan of correction.
Yes.
So let me do our little awesome graphic here. Hey, we on to something. So we have this F tag pulled up. Veronica, as always, sorry, plan of correction. She has this plan of correction, which is the same as our F tag. Did you want me to lead with this, or do you want to lead with this? You want me to pull up your graphic? Where do you want to go with it? I'm open.
Actually, this one is the Ohio one. There's a Maryland
Hmm.
one. So
Okay,
we
you
can
want me to
start
get the
with this.
Maryland one?
So
Okay, let's go.
we'll start with this one. So this was the F tag. This was an Ohio nursing home where a resident received IV medications. They were flushing the pick without an adapter. And the state, asked them, so they did not follow the proper protocol for flushing a pick line. This was an agency nurse, and so this is very um,
Every time, every
yes.
time.
And so this is why I pulled this one specifically. We'll talk about another one next. But I wanted to stress to our viewers and listeners that we are still responsible to make sure that our agency staff are competent and trained and ready to care for our residents. We cannot say that the agency should have done that. And so that's what this
Hmm.
happened. So once they interviewed the agency nurse, she said, this is how I was trained. Ohio was a state. I was
Never
licensed
fails.
LPN in Ohio. And I was licensed in 2000 as an LPN. And so I went to nursing school in 1999 in Ohio. And at that time, they did not offer IV certification as part of the LPN program. So at that time, you had to take a separate course.
Hmm.
I had to pay money, take a separate course. I did do that because I did do some work in hospitals, and so you take a separate course, you take a separate IV certification test, and then you get IV certified. There was a period, I believe, starting after that, 2003 maybe. I'm not sure the exact year, but they did start incorporating that into the LPN program so that when you graduated LPN school, you did come out with an IV certification. But I do believe since then they have abandoned that again. So the IV certification piece is separate. So that is very important for states like that who are changing legislation, because then you have to see what year this nurse originally was licensed to
Mm-hmm.
understand if she needs to have a separate IV certification, or if her IV certification was included in her nursing
So
education.
so help me understand, right? Because so many of us are dependent on agencies. How do we prep, right? Because what happens is the agency, they just come in and they feel. Is it our responsibility? And once again, these are hypothetical, and I have to, thank you, Chana, for telling me to put these hypothetical disclaimers on it, because as I'm getting into my expert witness work, she said, DJ, you got to protect yourself. So hypothetically, I know the answer for it. What should we be doing as administrative director of nursing to ensure that the teams that we're bringing on board, CNA, nurse, LPN, RN, is trained before they hit our floor? How do we protect that?
So if you have a relationship with a nursing agency, and so a lot of companies now, a lot of facilities are using designated agencies. I know
Mm-hmm.
there are some agencies that have certain competencies. I've worked agency before, and there were certain homes that I could not go to, that I could not
Yep.
book a shift with unless I did um, specific competencies, tests.
Yep.
There were some self-assessment. I think this nurse filled out a self-assessment where she said on her self-assessment, needs supervision or needs
And
assistance.
nobody looked at it.
No, yeah. So they did pull up. So of course the DON, the nursing home, said this is an agency person. The agency is responsible for her training and competency. The state reached out to the agency. The agency explained their process. The agency did provide the state surveyors a copy of her self assessment where she checks the skills
Clearly
that
said I
she's
need help.
comfortable with. And she actually said that she needed assistance or supervision, or
Mm-hmm.
she was not
Mm-hmm.
independent or expert level with IVs, right? And so, again, that did fall on the state, and they did get tagged under F726. And so I just wanted to
Wow.
include that because a lot of us
Wow.
are using agency, right? We have to
Wow.
use agency to fill the gaps, but I don't want you to get caught in a place where you are relying on the agency, right?
Mm-hmm.
Because you'll get caught up every time. And so sometimes it could be a miscommunication. So I want everybody who's using agency, who is listening to our podcast, to pick up the phone on Monday and find out what type of competencies you're doing, that they're doing with the staff
Yep.
sending you. And if you have, regular staff that you like, maybe you have a short orientation with agency. I know it's not optimal, but at the end of the day,
You
these
got to protect yourself.
your facility with your residents, and they have to know your policies, your procedures, your process.
Mm-hmm.
And so we can no longer use the excuse of their agency, right? And so I just reach out to
Agreed.
your agencies and say, hey, what kind of competencies are you doing? Hey, can you send over the skills needs assessment
And
before?
but you still need to verify, because you don't know if they had a nurse check them off, a front desk person check them off. You need to verify, because at the end of the day, you gonna get the citation. It's never the org, right? They may
Right.
get roped into the lawsuit, but they're not gonna get roped into the citation. So
And I
it's
find
you to
a lot of
verify
these agencies now are making you 1099. So you're not even
all day long.
employee of the agency. So then they remove their level of liability, right? Because when I used to work agency back in the early
I
2000s,
was employed.
I was an employee of the agency. I got a W-2 from that. No, they're not even
Yep.
doing that anymore. You're a 1099 independent contractor. And
Facts.
so I feel like they do that a lot to kind of remove some level of liability. So
Liability,
let's,
100%.
yes.
So, one of the things I had to do is you had to come and do a 4-hour orientation. We're going to hit you who the abuse coordinator is, because I am big on abuse. What to do in an event of elopement. I need to make sure you understand race and pass. So you got to tour the facility. So many times I've seen where a nurse would come in and we just give them the keys and say, there you go. We don't even get them. They don't even find out who the patients are, and they walking around trying to find Mrs. Smith and doing all this, and then I have med errors coming down the hall. And so I think in an era when everybody's trying to pinch pennies, we have to learn where to pitch the pennies at, and it's not skipping on orientation and training of a new employee, because you should treat them as that, because it's the culture. They may come in as a temporary staff through an agency, but they may want to work with you.
Mm-hmm.
So you should have your best behavior out at all times.
Right.
So for me, I want the audience, like you said, Monday, take away. I need you to do an audit. I need you to pick up that phone as you stated, but also verify yourself. Trust, but verify. A good friend, Cassandra Fuller out of Detroit, she's taught me trust, but verify. Check the checker is what she would always say to me. Check the checker. So that means you're coming in, you're having your SDC verified. Another thing these buildings get tagged on, they send these nurses without CPR cards, and you have a full code.
Don't know how to work a defibrillator, but also, like you just said, you don't give them a facility tour. Do they even know where the crash cart is?
They don't. They don't. They don't know where the crash cart is, and so that leads to some of the issues that we see time and time again. And I know you have this other F tag here. Talk to us about another plan of correction. Talk to us about this plan of correction here.
Okay, so this one was a Maryland home, and so they did an investigation. This was actually in January of this year, and so some of the events happened in early and late 2025. But they had a CNA who left the resident on a toilet. The resident was a fall risk, had failed earlier in the week. The care plan had been updated to say that the resident needed assistance and to be supervised during toileting. So the aide should not have left the resident on the toilet. So the aide left the resident on the toilet, and they had a second fall while attempting to use the toilet in a week, right? And so according to the resident's care plan, they require moderate assist and for toileting. And so again, the fall investigation said that the intervention was to stay with the resident during toileting, and so they did not follow their own intervention. And so they also looked at there was at the aides involved, there were no annual skills checkoffs. There were no annual evaluations of the skill sets, right? And so an online training, one of the aides did an online training, was an online training, but there were no additional skills checks, like no in-person skills checks that were found in the employee's file. And so again, then they had another family member actually contact the state while they were there. They were saying that they felt that their loved one was improperly transferred. And so when they interviewed the resident, he explained how he was transferred to and from I believe, a toilet or a bedside commode. Anyway, he was transferred to the bed. Apparently, go ahead.
They're going to go to that care plan right away.
Yes. Apparently, this person was contact guard, right? And so apparently the CNA, when they explained to the state surveyor how they transferred this patient back to the bed, they literally grabbed this patient's ankles and lifted the patient's leg. And the patient had a broken leg.
What school was that taught in?
So,
help me understand where they taught that at in any CNA school.
So it literally says contact guard support provides hover hands, light hands, or holds
contact.
Right, contact guard, staying physically connected to the patient throughout the movement. Right. So the nurse aide reported lifting the resident's legs up off the bed, and that the resident yelled, "You are hurting me."
Okay.
So again, when they went to that employee file, there's still not an annual evaluation, not a skills check. The DON was notified by the state about what was going on. And the DON actually said that she was concerned about the lack of training and education that the facility had.
Yeah, you can't just hire them. You have to have some level of onboarding. And so I have a friend, Dr. Sylvia. She does nurse training onboarding and CNA onboarding, where she will come out to your facility and she will educate and develop a onboarding process. She also has an app called My Nurse Pal. If you don't know about it, check her up, Dr. Sylvia. We'll link it in it. And she also has an app called My Nurse Pal. And yeah, she created that business out of necessity, right? So many nursing homes don't have an adequate training program. And she saw time and time again where these buildings will get cited. Your SDC is not the place you want to cut. Your staff development coordinator, one who's in charge of often keeping track of your CPR, your TB tests, all your trainings, your CNA trainings, your nurse aid competencies. They are the one who is there for you. There's a couple of people I don't want to cut in the nurse home. I don't want to cut the TON. I don't want to cut the SDC. And I sure don't want to cut the money, which is the MDS nurse.
Right.
Unfortunately, what I see, roles get combined. Next thing you know, you the SDC and the infection control nurse. Well, CMS has changed. You can't just do that anymore. You can't have a part-time
Right.
you're right. So, but that's what I see often. And so when we talk about having sufficient staff, this that I have up on the screen, right? Facility that must prove staff's processes, possess of specific staff required for resident care, right? That's
Yes.
something that you talked about, right? How do we prove that? With documentation. Because if it
Yes.
ain't documented, it ain't.
It ain't done.
You already know. So as a nurse, that's beat into us, right? And so when you talk about these anatomies um of compliance and the levels of harm, right? As you have here on the screen, you can have an IJ. You don't want that.
No.
You don't want an
No.
IJ. ten
It's
thousand
just
dollars a day at a minimum for the first few days, right? And I know from doing my research, right? On average, it's 4.5 days. That's $45,000 on an IJ. What you just spent on an IJ was equivalent of a FTE, depending on
right.
what role you got him in. It was equivalent of a FTE. So when
Hmm.
you thought you saved, you actually spent more because you got an IJ. Don't get two of them at a time because
Yes.
you're gonna spend more. So you know, it's an interesting thing as I talk to owners and I talk to people about um, deficiencies and what it takes to not get them. And this is a survey readiness podcast. So our goal is to provide you with real world scenarios, with real world solutions to scenarios. So that way you don't get these deficiencies, right? So
Right.
you got another thing here. Talk us and walk us through this one.
Oh, so
I
these
think
were the
this,
ones we just talked about.
yep.
Yeah. So you
Okay.
actually see this incident one where they were left unattended on the toilet. And then the next incident was the improper transfer. Actually, that led to the fracture. So again, and that's definitely a harm level. So like you said, you don't want to leave yourself open for these type of tags, and you don't want to leave your residents at risk for injury, right? Due to just not training. So when we go into our F tag of the week,
Take us there. Take us there.
our F tag of the week is F726. Okay, so this is just talking about staff competencies, right? And so again, we don't want to generalize this. So when you're looking at the competencies needed for your facility, right? Even if you have a part of a corporation, but there may be a specific population of residents that you care for. So the things that you look at when you're building a competency program are going to be the resident population that you serve. Do you have a dementia unit? Do you have a behavior unit? Are you working with memory
Facts.
care?
Facts.
Individual care plans, right? Or do we have a lot of care plans where we're doing isolation, right? So maybe we need to have an isolation competency where we can show that we know how to don and doff protective equipment. Facility assessment, definitely pull up your facility assessment. We every facility should have a facility assessment. I used to do.
All day long.
I used to help facilities complete facility assessments, and a lot of times you would just look at it and say, "What is this?" Right? And so you should be also updating those annually. And so I tell a lot of the clients I work with, do it during budget time. We do budgets every year, and so make that the time that you're doing your facility assessment updates. So your facility assessment will actually have the population of residents you serve, whether it be the demographics. You could be caring for a lot of younger people, right? We know that nursing homes are no longer
Yep.
where grandma and grandpa go to go play
Facts.
bingo for the rest of the days. And so a lot of our demographics may be a lot younger, and so we won't have the same type of competencies, maybe, or even the same activity programs for a 40-50-year-old population that we would have for maybe a 70-80-year-old population, right? And so looking at those demographics, cultural, are you having different cultures that you care for? Are your staff receiving that type of cultural training to be able to care for those people, right?
Mhm.
So this applies to your licensed nurses, your CNAs, your agency staff, and then also it's just not nursing competency, right? It's competency for your entire organization. And so we a lot of time we do say, competency related to nursing, because we see a lot of the tags are related to nursing, but we don't want you to only think of nursing, right? What kind of competencies could we need with our dietary staff? And we just talked about cultural, right? Maybe they have food preferences, dietary restrictions related to their culture, religion. Are we then providing that training to our dietary staff? Do they understand that they are not able to substitute something because they don't have something available that this resident eats? I've seen a citation where a resident was not receiving their culturally appropriate meal,
Mhm.
and the kitchen was like, well, we don't have that, or this is all we had. And
It's
so
not
we
acceptable.
cannot. Yes, exactly. And so just making sure that your competency matches the residents that you care for, not just the job description, not just all the CNAs do this. No, what are the type of residents that we care for?
One of the things you talked about, I'm flashing here on the screen, right? That's what SurveyGuard is designed for. SurveyGuard is my post-acute care compliance platform. It has facility assessment built in. It has the QAPI plan. It has your PIPs. It has your guardian angels, your grievances, your writing, your plan of corrections, your survey prep, your audits. I mean, everything is built in here. And as I just mentioned, we are officially on Point Click Care's website and Matrix Care website. We are integrated partners with both. Now, Veronica, now you do quite a bit of fixing of things yourself, right, through your organization.
Mm-hmm.
And I know you recently redid your website and put that QR code right on your screen. How did they get in contact with you? Talk to them about what's on your website and what you really do, because they hear you talking about survey prep, but you bleed survey prep. This is you. You are a quappy person. Talk to
I
us.
love Quappy. Actually, I just sent out a directive to our facilities to send me their next Quappy meetings, because I'll be going around attending Quappy meetings.
We
And
need to
so
get survey guard in your building. I'm just saying, we need to
we
making
had to
that
talk
happen. So we
offline about that. So yeah, I work a lot with nurses on education training. I'm actually releasing an MDS course next month for any nurses that want to get into MDS, away from bedside. I've
Mhm.
gone away from working one on one with nursing homes. I just am really
We did.
concentrating on spreading the knowledge and education. So I do have some learning labs coming out where I can go over the actual QMs, go over the ins and outs of it, provide some audit tools for you to do some
Mhm.
self assessment, some self work. Um, just because it takes a lot, right? And you understand it as well. When you're working with QM improvement, it's month over month. So again, administrators on the line, DONs, this is work. This is month over month work, and so it just takes consistency. It takes teamwork. And so it's not something that's you're going to wake up tomorrow and be a 5-star facility, but you can be. And so I want to help facilities be able to do that, but it's only one of me. So what I'm building is the tools that you can take back and apply yourself. And then of course you'll have access to me to call and review some stuff. But the one-on-one, I'm limiting that, just because I do want to spread my impact. We keep talking about impact. So again, I'll be sharing updates in the next couple weeks. But thanks for sharing that, Demetrius. I appreciate it.
Hey, let me show you. You ain't seen this yet. Now, just I be having to give a little snippet, right? Because this is what we do. Um, de-identified data. This is just an example of what this report looked like. But this is a PIP, right? Your problem statement, your project overview. It gives a little bit of the root cause analysis,
Look at
your
that. Five
goals,
whys. That's my favorite.
hey, listen. When I say we are the co-op platform of choice for the post-acute care space, I'm not playing. I'm not playing.
Look at
Now,
that.
that's all they get right now. That's all they
Yeah.
get. They got to book a demo to see a little bit more, right? So,
Yes.
um, we coming for you. We want to
Best.
be the compliance platform of choice for you. We definitely are already the mock survey company of choice for you. As you know, I travel around the country doing mock surveys. As I said, I will be in Minnesota in a few weeks doing a mock survey. And from Minnesota, I go to Ohio. From Ohio, I go to California. From California, I go to, I want to say it's like Kansas or something. We have another onboarding. We're onboarding 2 facilities for Survey Guard during the month of May and June. So we officially launched our beta, and we will have facilities actually utilizing our platform, So, and we got to get yo. We coming soon. We coming
Yes.
soon. Veronica, how do they reach you?
You can reach me at Veronica at veronicacaesar.com. That's my email. You can go to
Hey.
veronicacaesar.com, look around. I'm on LinkedIn. I'm tagged on your stuff. I have I have a newsletter that comes out every Monday. So look for that
How you
tomorrow.
so consistent? I be like, how? People say I'm always online. I be like, how? Right. So check out her newsletter. It is amazing. You can find her on LinkedIn. You can subscribe to her newsletter. While you're on there, check out SMK Medical's page. We have about 7,000 followers. 5,000 of people go to our newsletters. They get access to our free
Oh,
tools
I
and things
saw
as
your
well.
review too
Hey, we out
from
here.
your facility. Yes.
Yeah, we
The
out here.
shy guy. He was very shy. He didn't want to talk, but yeah, that was
Yeah,
very.
so we did a mock survey. This is our third, fourth year doing a mock survey for a facility here on Island. And I said in the video the facility is Island's nursing facility, is a small 42, 37 bed facility who has trachs and vents. And we've
Mm,
continued to do mock surveys. In fact, they saw over a 75% reduction once they brought us back on to do their mock surveys. One year they wanted to try it themselves. It didn't go so well. But then they brought us back, and the next year was really well. So
yes.
companies are seeing 75 to 80% reduction. And yes, while there is a cost, we like to say we come in and we do training and education with you, right? So this is not a gotcha moment. We're
Hmm.
here, we're doing training and education. When we leave, you have a QAPI. When we leave, you have a plan in place of past non-compliance if the state were to come in. We're
Hmm.
not just here to do an audit and leave you. We are the mock survey provider of choice. We literally have trademarked the word mock survey. We literally own mocksurvey.com. That takes you right to our website. So, yeah, I appreciate it. I appreciate it. Before I wrap this up, anything else? Any last parting words?
No, stay ready so you don't have to get ready.
Hey, you know what? I'm with it. So, as we wrap up this podcast, thank you for spending time with us on the Survey Readiness podcast. This podcast is a product of collaboration with SMK Medical, Survey Guard, and Gem Healthcare Consulting, which are organizations focusing on strengthening leadership, compliance systems, and survey readiness across the post-acute care space. The views expressed in this podcast are for educational purposes only and do not constitute legal advice or regulatory advice. Regulatory regulations change, survey interpretations varies, and listeners should consult appropriate professionals when making operational and compliance decisions. If this episode has helped you think differently or prepare earlier, hit that subscribe button, hit that share button, hit that like button, share with your leadership team, and join us right here for the next episode. You can follow us on all platforms, including YouTube, iHeart, Alexa, so much more. Simply search the Survey Readiness Podcast, and you can follow me personally at Your Healthcare Consultant. Until next time, stay survey ready.